As Premier said, modeling is an estimate based on the best known data at the time that the model is put together, but we will continue to adjust it based on emerging Alberta data and evidence. And so you will, as was said, see this model evolving over time. But the most important factor in how big or small the impact of COVID-19 is in this province is the behavior of each and every one of us. This cannot be stressed enough. If Albertans stop following public health restrictions and guidelines, we can expect to experience a higher impact than the data currently suggests. If Albertans strictly follow all public health guidance, we collectively can further reduce the impact from what the modeling is currently predicting. To the people who might look at the scenarios presented today and think, well, those aren't that bad, I want you to remember that every person who is in hospital, every person who passes away, is beloved by family and friends, and is a loss. This is not the time to relax our approach. To those who look at the numbers and think they are frighteningly high, I say to you, we can change the outcome. Remember that the modeling is giving us the total number of anticipated infections in the whole population, not just the confirmed cases. That makes the numbers higher than what we have seen in other countries who are reporting their confirmed cases. It is also based on an assumption that every COVID case spreads infection to one or two other people. We can collectively reduce that. Changing our total infections in the province is in our hands. Every action makes a difference. Data makes a difference as well. And with that in mind, although none of us need a lab test to do the right thing, we are making some additional changes to our testing criteria to ensure that we have as much information as possible to understand how our outbreak is unfolding. Even with the recent addition to our testing eligibility to include seniors 65 years of age and older with symptoms, our daily testing numbers are still lower than our labs have the capacity to test. Therefore, we are looking at our data to determine where to strategically use testing capacity. We know that Calgary has had a higher % positive rate in their lab testing, and this has persisted even with the change in our testing this last week. In order to get as much information as possible to reduce spread in that area, we are expanding testing effective immediately to include all residents of the Calgary zone who have a cough, fever, runny nose, sore throat, or shortness of breath. We are also opening testing to essential service workers across the province with any of the same symptoms I just mentioned, and we are defining that as anyone whose work site has not been closed to public access by public health orders, and who, if they were well, would currently be working outside the home. I want to emphasize we continue to expect anyone who is ill to remain home for at least 10 days from the start of their symptoms or until symptoms resolve, whichever is longer. Finally, anyone who has any of these same symptoms, again, runny nose, sore throat, shortness of breath, fever, or cough, and who lives with a person who is 65 years of age or older, is also eligible for testing.